I wanted to take a moment to introduce this part of the module. It leans heavily on the theories about how we change. Any learning theory that espouses change or taking action requires at the get-go that there be awareness. Here I'm referring to personal awareness, an understanding of our strengths and of our limitations. It also takes into consideration our situation, as it is our environment that provides us the stimuli to which we then react by taking action, taking cover, or taking a stand. In a sense, our life could be considered a personal experiment. We observe, react, compile results, and we modify our thinking and behavior accordingly. It makes sense then to see that forward movement in our life is not linear. Perhaps as Hegel envisioned history, it is an ever-expanding spiral, with us gathering more and more information and knowledge and experience as we move along. Consider another metaphor, the barometer, means of forecasting weather. In our case, anxiety symptoms would act as a kind of barometer of distress. This barometer would be unique to the individual. My barometer reading at this very moment will likely be different from yours. And it's this barometer that would fluctuate, as it is dependent on many factors. Awareness of our internal barometer reading can give us important information about how we're doing, about how we're coping. Awareness can also help when there is a forecast of troubles ahead, providing an indication and the motivation to start planning next steps, planning the action that we may need to take to manage the incident, the event, or whatever the situation, and also to manage our own emotional and sometimes physical reactions that can result. A stepwise approach to the management of anxiety, for me, makes sense. Once we are securely on our first step, awareness, the second step then takes into consideration our personal preferences and inclinations. For example, do we prefer to use medications if we have a panic attack as the first-line treatment, or would we prefer a non-medication approach? And so we work out the necessary plans before stage 3, which is taking action. As with any newly obtained skill, we need to maintain it, leading to a sustained change in how we feel, think, and behave. This requires acceptance, practice, and an openness to expand our ways of coping and to discard the methods that have been less than helpful. In this part of the module, there are case vignettes that illustrate some of these points along the way.